Thank you. My name is Michelle Allred, like Sharon said. My background in nursing is I spent probably 10 years in a pediatric ICU setting and another 20 years in an emergency room setting. But most recently, I'm here at Oakland County in the health department, and I oversee the lead program at Oakland County. So I'm not going to take a lot of your time today. I remember what it was to be a nursing student wanting to get out early, so we'll have you in and out in a half an hour. At the end of my PowerPoint presentation, I did bring a lead analyzer with me, so that I just brought one kit with me so I could test somebody in here, a little capillary check, to tell you what your lead level is and give you those results in 3 minutes if you're anyone's wondering. So just keep that in mind if somebody wants to get tortured afterwards. All right. So to start, so some of you may or may not know this, but lead is the most common environmental threat to a child's health. And back in 2021, they studied and found that 3,400 kids in the state of Michigan between ages 0 and 6 were identified as having a high level. So you might wonder what a high level is. There is no safe level of lead in our bloodstream, but the CDC uses a blood reference level of 3.5 micrograms per deciliter to identify kids with blood lead levels that we really want to focus on. So hazards that we see most commonly in Oakland County, paint and dust, as you probably are aware, are biggies. 70% of the houses built in Michigan were built before 1978. So as many new builds as you see going up, there's a ton of really old homes. I live in a 1928 arts and craft bungalow, so I'm one of those people. And then just keep in mind that all these renovations that are going on in the old homes, it's not just little kids who are pica kids eating paint chips. It's people breathing in the paint dust when you're doing renovations. After paint, soil is the second leading cause. So just imagine everyone's homes in certain subdivisions are built on soil that once had pesticides spread all across the soil. And then water's another biggie. Plumbers stopped using lead in pipes and faucets back in 2014, but a lot of us still have old water systems. So where else can there be lead hazards? Lots of spices, turmeric, chili, paprika, and other spices that are imported from foreign countries can cause some issues. A lot of mom and pop stores at the corner that people are buying spices from, maybe from online sites that aren't approved by the FDA. Those are the ones that are most concerned. Products in homes like cheap plastic toys from the dollar store, pottery, ammunition, makeup. And then my personal saddest potential lead exposure is chocolate. We have what's called a maximum allowable dose level of lead in our food and drinks that we all consume here in the US. And a lot of these chocolates listed have significantly more than that maximum allowable dose level. So my favorite chocolate bar from Trader Joe just got removed from the shelves. That's the one I listed as #1. Wow. Yeah, we all think we're supposed to have dark chocolate. It's good for our hearts, but dark chocolate has a higher lead level. So make sure you're reading about it before you consume it. Then we got to consider Oakland County residents who might not be U.S. citizens or who are new to the U.S. Lead poisoning impacts refugees and immigrants disproportionately because of the environmental hazards that they were exposed to before they even came here. These people are often lead burdened and should be screened as soon as possible once they arrive to the U.S. So the Childhood Lead Poisoning Prevention Program, or we call it the CLPPP, has a mission to prevent childhood lead poisoning across our state. And they have a vision that no child's going to suffer from lead poisoning. So that's where we come in. The Oakland County Health Department works really closely with the CLPPP. Each week I get a list of all the kids ages 0 to 6 in Oakland County who are tested and who have a level of 3.5 or greater. And then I assign that child to one of the nurses on our lead team to just go and approach the family. Can I come out? Can I come to your home? Can I do some education? Can we do some inspection? The family can certainly say no. It's completely voluntary. But they work with the caregivers who do say yes to increase awareness of lead exposure, connect them with resources, and discuss treatment. We also have dietitians through Oakland County who go to the home and just kind of tweak their diet. A lot of it they have to be careful being culturally sensitive because a lot of people are very strict with certain diets, depending on their country of origin. And then our nurses work with the environmental health team at Oakland County. They go in, do very thorough inspections and let them know things that need to be removed. So then they work with mitigation efforts and abatement efforts. So children and pregnant women are our target audience. Children between the ages of 0 and 6. So you might ask why. Children are way more susceptible to lead poisoning because the neurological system does most of its work in those first 6 years. There's significantly more lead absorption in kids than adults. 70% of lead is stored in the bones of kids. And they're all on the floor playing, putting things in their mouth, unlike us adults. I mean, we spend some time on the floor, but nothing like a toddler. And then if kids are iron deficient, lead actually substitutes for iron in their bodies, which is pretty scary. This is just a risk assessment I just wanted to share with you. If we ask a parent these questions about their child, if an answer is either yes or don't know, they absolutely need to be lead screened. Like a perfect example, does your child currently live in a home built before 1978 or that was recently remodeled? Pregnant women exposure, lead readily crosses over the placenta, through the placenta. Lead is found in the fetal brain by the end of the first trimester and can impair neurodevelopment. And high maternal levels increase risk for low birth weight. Just wanted to give a little example. We went out to see a child who had a lead level of 26.4 in Farmington Hills. It was a 2-year-old. They were just here from India, probably just 5 weeks. And when we went into the home, the mom and dad were very welcoming and eager to learn about what they could help with. But the mom was nursing a 3-week-old infant. And so knowing that this child who is 2 has such a high lead level, and they've only been in the US and on our soil for a very short period of time, we can be pretty certain that the mom is also lead burdened and nursing, so giving her new infant lead as well. And so that's just a conversation that's somewhat awkward and difficult to have because of course we want to encourage nursing, but we don't want this mom to nurse this child until she gets tested herself to make sure that her lead level is not high. So that was just an example. This is a risk assessment for a pregnant mom. Very similar questions, but just geared towards a pregnant person. So best practices presently, just to test pregnant and lactating women when at least one risk factor is present. And then test all little people at ages 1 and again at 2 or up to age 6 if they have not previously been tested. So the bad news. Lead neurotoxicity. So if I've gotten you all sleeping through this little lecture, this is the one slide I want you to remember and take away. Lead exposure early in life has been shown to cause problems with learning, behavior, hearing, and growth. And symptoms include a reduction in IQ, an increase in learning disorders, and an increase in violent behavior. So lead neurotoxicity is irreversible, but completely preventable if we can get to them before it happens. A decline in testing for lead. So back in 2016, this isn't even a brag moment, but back in 2016, we were testing about 20% of kids in Oakland County. And then it went way down to 16% in 2021. So the dramatic decrease in testing is attributed to our pandemic, less well child visits that led to many kids not having the screening at all. So we got to get these kids tested before they have permanent neurotoxicity. So the sad part is before our pandemic, we were still only doing 20% of kids in Oakland County, which is a really sad percentage. That's just a little bar graph comparing Wayne, Detroit, Oakland, and Macomb. So you can see back in 2016, all of the numbers were a little bit higher than they were in 2021 post-pandemic. And some of us have improved a teeny bit in 2022. Oakland County went from 16.4% to 17%, still a super lousy number. So we need to work on that. This is also an interesting bar graph because the capillary test that we do and that I'll do today on one lucky volunteer is just a preliminary test. Lots of things can happen. Maybe I didn't get their hands completely clean. Maybe I just something could have happened on their skin that had a little bit of lead. So the level could have been higher than what it really is. And so what we ask is if it is 3.5 or greater, that they return to their primary care doctor or go to a lab and get a confirmatory venous test, just venous draw through your arm or your hand. And we're only seeing about 51% of people going back to get that confirmatory test within a month's time. So we got to work on that too, just education of the providers. And we provide a prescription from our medical director at Oakland County so that if I draw a level and it's greater than 3.5, I can give them a prescription. So if they don't have a primary care doctor, I just don't want there to be any barriers for them to go and get that confirmatory level. The good news. The people that we are testing, we're seeing a lower value than 3.5. So in Oakland County back in 2016, you can see that 2.8% had a level of 3.5 or greater. But in 2022, it's down to 1.9%. So hopefully people are getting the education that we're trying to put out in the community and understanding what some lead exposures are and getting rid of them. So future ideas that we have to increase the lead screening in Oakland County, we have our community nurses who are doing home visits, bringing the kit and doing a capillary draw in the homes of both pregnant moms and toddlers. We have a presence in our WIC area as well as our immunization clinic. And then having more outreaches, going to health fairs, Head Starts, different things like that. And getting the word out to primary care doctors to get the lead testing done in the offices. So this has been big. You may or may not have seen this in the news, but legislation is always super important to boost detection and mitigation because we rank 3rd in the nation for kids with high lead levels, and that's not a podium that we want to be on. So we don't want to be 3rd. We want to be much lower than that. So they introduced a bipartisan lead bill in the House of Michigan that said we got to do mandatory testing on all 1-year-olds and all 2-year-olds. So the governor just signed this in October. It was passed, and we see that this is probably going to happen January 1 of 2024. So we got a lot of work to do between now and January 1 to make sure all the providers are aware of this new legislation. And that's it. That's all I got. This is just if you know of anyone who serves a large population. Some of you may have jobs that you're working for providers or you're working with little people from 6 and under. We will come out, we will draw lead levels on little people. We'll come out and educate. That phone number is our nurse on call at Oakland County for more information. And then this is my information, both my phone number and my email. And that's it. Any questions?
I have a question. If excuse me, in the hospital before the baby's discharged, is there any chance that there'd be benefit to having them screened? Because you know they do a lot of things. They do like the newborn screening. Is that on the newborn
It's
screen?
not on the list of the newborn screen. It's a great idea though.
Yeah, why not?
Because then you can really catch it early, literally within hours of the age. Yeah, of being born.
I cannot believe that it's not on the newborn screening thing. Because they have all kinds, for those that don't know, when a baby is born, they try to screen them very early, like almost shortly after they come out, basically. They prick the heel, they have a card that has about, I'm gonna say 12 maybe circles, and it's on each circle you have to, it's like bloodletting, not really, but you got to get enough blood to cover those circles, right? How many know what I'm talking about?
It's almost like a bubble test.
Yeah, it's like a bubble test. So yeah, you have to do that, and then it gets sent up. Do you have a question?
No, I have more of a comment.
Yeah.
What would be the use of that though? You're not testing for environmental hazards at that point. You're testing the difference between if the child's going to get any lead deposition from the mother. So you'd be better off testing the mother during prenatal periods than you would testing the newborn.
And we already are doing that, but
Right.
if it's been missed, if
Yes.
mom didn't get tested in her OBGYN regular visits, or she didn't have any prenatal care, this is just a way of letting us know the people in this home are at risk.
Yeah, you know. I mean, I I think it is probably a good idea, and if they're already getting blood on the card, I mean, it would just be, I don't know, maybe we could even be combined so that we're already getting, sometimes you can draw a tube of blood and
Right,
it'll cover a lot of things, right? So I don't think it could hurt if they added it on. So anyway, it does, because as you might already know, it helps to find out, okay, are they gonna have anything like disorders with Tay-Sachs or something that tells me they can't digest the protein in the milk, other things that are there, with the newborn screen. So I don't know why it wouldn't be, also integrated with that. Because there are times when people don't get prenatal care, you're just seeing them for the first time, as they deliver something. So what are things you want to think about? What other things do you, somebody has a high blood level? So we know that, okay, something, what can be done to, with that little kid that's 2 years old? What can you do besides know that it's high? Does anybody know? We want to, reduce that ASAP, because we don't want it to cause permanent, disability. Anything? Can we get rid of the lead in our system?
so at Oakland County offices, both at north and south, those of you who live near the Southfield area, it's like 11 Mile and Reed, and then the north office is located at 1200 North Telegraph. But you can bring water samples in, and I think for $25, they'll let you know if you've got lead in your water. They'll also give you filters at Oakland County, both offices, so that's something to think about. But just kind of think about if you have hobbies outside of the home, if you are, you tinker with cars or clay, or you go to target practice, the gunpowder, all of these things are something to think about before you come to into your home and introduce that lead to your family. So take off your, like as a nurse in the ER, we always took off our scrubs before we even walked into our home, and hugged your family members. So, I make my family take off their shoes now before they walk into their house, because it's just something to think about. You've walked on the soil, you're bringing that in. So it's just kind of a wake up call when you're out and about, keeping in mind things that you may have been exposed to while you're out and about, and bringing it back to your home.
I thought that there's some credence to this. If it's in your system, can you reduce it through the foods that you choose to eat?
Absolutely.
Okay, so
Our nurse case managers, when they go out and they start educating families, what we do is we give all the education we possibly can. We do inspection. We try to remove lead sources that are super obvious, that we find are obvious. And then every 3 months from there, we have the family get tested again, a venous test, a confirmatory test. And we watch it slowly trend downward. And then we no longer follow the family when it goes below 3.5. Some problems that we have will get it going lower, 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 and then the family goes back to their country of origin for a period of time, 6 months or 9 months, and then they return and the levels back up again. So it's a little bit of that's a tough situation that we don't know how to solve that exactly. But if a level is 45 or above, they get admitted to the hospital for a chelation process. And I don't know if those of you who know what chelation is, but just removing the lead out of your bloodstream. The problem I think that a lot of families have when you tell them their 3-year-old has a level of 7.0, and we'd like to do some education and an inspection of their home and talk about their diet, is their child may be acting very appropriately for a 3-year-old or however old they are, and the effects of the lead exposure has not yet taken effect. And so getting them to agree to this very free service that we provide sometimes can be difficult. Sometimes they say, oh, my doctor hasn't, really said anything. He's meeting all his milestones. I think we're all set. Thank you very much. So
yeah, it can be, I'm putting myself in that person's position and saying, well, you want to come into my house?
sure.
What do you, that's kind of invasive,
Right.
And what's wrong? What's wrong with my child? Doesn't look any different.
Sure.
Right? but it is important to, you know, emphasize, but then again, the person does have the ultimate say as to how much further they want to go. But it's kind of interesting when you think about high lead levels, and we know this, that it's higher in large cities. A lot of contamination because of the industries that are there. And then what else do we see? We see the results if it goes untreated. Uh, Anger issues, violence issues. I think it'd be interesting to do a study, just cursory, you know, you go to Oakland County Jail, or you go to the Macomb County Jail. Test those people, see, you know, what is it? Is it the lead levels that are affecting? And by that time, it's the horse is out of the barn, so to speak. But you could just look at that and do a study and see, you know, those that are incarcerated in general,
Right.
you know, compare and contrast between somebody, you know, maybe you do 50 men and women in that work at Ford, maybe, right? I don't know, whatever. It really is food for thought. And obviously it's best, prevention is the best thing. And then also getting the younger people, because they won't suffer the long-term effects if it is discovered.
Right.
And
And I just want to be clear, it's not just low-income families who might live in an older home. We also have a lot of affluent families who, another example of a little guy who had a level in the 30s. His grandfather had saved all of the vintage Matchbox cars from his father. And so this child was obsessed with playing with these Matchbox cars. And that's what he did every minute that he was awake. And it turned out that these cars had a significant amount of lead in them. We removed those and his level dropped significantly. So just some, you know, something to think about.
it's very interesting. And if you're in the home, is there, like, if you want to test your children's toys, aren't there kits, is there kits out there that you can?
There are some kits, but if you have a level of 10
Yes.
or greater,
Yeah.
we automatically have our environmental health team go into your home that it's completely free. Now, the actual removal of the, like, let's say it's a paint or something to do with the windows, or you've got a landlord, then there's obviously, it's a little bit more complicated and that part of it's not free, but we can apply for state aid for there to be a discount with the mitigation.
Very interesting. So who wants to be tested? We know of someone that is expecting. Yes. Okay. All right. We gotta take her. I need you and I flip a coin. There's only one kid. I apologize. There's only one kid. So
You can come see me in Oakland County anytime and I'll test you. I just
okay. Yeah. Okay. So you were. Yep. Yeah. The kids do things up here. Okay, so you guys can watch. I don't have a overhead camera.
Nobody.
Yes, I got this.
I don't know how you can ask people who are online. If they can see this.
Oh.
We only need a wide camera lens, so that. Maybe I got rid of my. My eyes got It's not. Okay, good. I don't know if they have. Good. People are not watching stuff. No. I don't think. Oh, by the way, I do have flyers, Oakland County flyers, and my card. If anybody comes up with questions or concerns that are specific. Well. What's your name? Caroline. Thanks, Caroline. So if you guys want to get up and watch what's happening, you can.
You mind?
No. Okay, so this is a lead care tube analyzer that we use. The nice thing about this is it's super portable and, our representative sends us supplies if when needed. I did have a supply chain error when we booked this, and that's why I only brought one kid.
Oh.
But anyway, it allows us to bring this to outreaches, health fairs, schools, Head Starts, and do a lead level in 3 minutes, which is super nice. So. So we won't do that. Everybody witnessing that she's consenting for me to torture her? Yes. Eagerly. Really good napkin.
You need something? I got a paper towel and good.
Yeah, I'll take a picture.
Yeah, okay.
So we use these little let-offs. You could also probably use an alcohol swab and it's just fine. And then we just use a lancet. It's really just as easy as getting a little bit of blood, putting it on the strip, and just waiting the 180 seconds.
It's really hard though when you've got a little kid that's scared
Right.
out of their mind.
Holy shit, stay still.
Well, it's kind of like, I don't know, my favorite Christmas tree, one of them, is Elf, right? You know, like it's a. It's stuck. That's my favorite.
So once we poked her, we collect with this, just like a little straw really. Fill the blood up to this little black dot. It's hard to see from the back, I apologize. Probably gonna get down on my knees just so that I can. Okay. All right, so what, those, who's done a capillary poke on little people or big people? Yeah. So I usually like to go with the middle finger, really any of the 3 middle fingers kind of off to the side, but still where it's kind of cushy, kind of stay away from the nail. And ideally do it on the bottom side, so that you've got gravity on your side. And like I couldn't walk away from a toddler after I cleaned it right now because they would be all over the mat. I just wait for it to dry. Okay, 1, 2, 3. Clean it with a little gauze. Then I just start.
Giving it up at peace.
Your hands are cold though.
Oh.
So sometimes this takes like 2 seconds, and sometimes it might take closer to a minute. So I'm just collecting. Oops. About halfway there.
No. Because I think if that was the case, it's gonna come out of money.
So I've collected my blood. And then I've got this little tube here. With a little plunger. This is where you're old like me, you need glasses.
In that club.
I'm gonna just. You're in that club too.
Yeah, glasses. Yeah.
Got a little squeegee here. So I'm gonna put my strip all the way in and it kind of starts talking to me. It says, we're all squared away and ready for you to add the blood on this X. Putting the blood on the X. Once it has enough, then it tells me we've got 180 seconds. So that's really it. By now you've got kind of a sad little toddler, usually. And so, we went to a Head Start in Lake Orion and another one in Ferndale. We sent consent forms early in the week to be sent home in the backpacks. And, families filled out the consents and we showed up on Friday, maybe 10 or 15 little people. So that's been great and it saves the parents a trip to the pediatricians. Used to have, Medicaid would say you absolutely have to have this testing done. But private insurances, while they agreed it was a good idea, they didn't really push the envelope, so they didn't cover it.
Yeah.
So that was part of the problem, so that's why this legislation that's coming through in January 2024 is huge for us. So we'll be really busy. But getting the older pediatricians who've been in practice for a really long time to buy into it and the magnitude of it will be, you know, definitely a barrier for us and we'll have our work cut out. Oh, do you? Yeah, it was right. It's a cute little area. Trying to think of where that Head Start was.
We got letters off it.
Oh, really?
Little pipes.
Yeah. Yeah. And you know, I showed you the different, the chocolates that were taken off the shelves and that's concerning. But there's also just things in the news, just be aware, be well read. There's like those little apple juice packets that they just took, there's a recall on those. Just little things that come up, probably see once every couple weeks that they've removed another thing off the shelves. So somebody is holding them accountable, which is helpful, but if you don't read the news and you don't know.
Yeah, and I think, I shop at different points a lot at the Dollar Tree, so I mean, you know,
Sure.
it's knowing that.
I think we've all picked up something at the Dollar Tree at one
Yeah.
point.
Toys and stuff,
Sure.
and there's such quantities, it does make you think, oh, they're cheap because. Yeah.
Right. There's another, we talked about makeup having high lead level. So not necessarily women in our blush and whatever, but also the sindoor that Indians wear. We had a family whose, the father of the family was a minister and, every day he would go to work with the sindoor on his face and the toddler would play with dad and play with it on his face and rub on it and his level was really high. So we determined like you should probably put this on once you get to work. Okay, so your level is low, which is great. So this particular machine will say either low or high in between the numbers of 3.5 and 65. So if it says high, you better get to the hospital for chelation. So that's it. So you can see that it was really easy, you know,